I'm excited to be here. I hope you are as well, and we're going to learn a lot together. Let's get started. The moderator of our first panel is Margaret Chesney. Margaret is a professor of medicine at the University of California, San Francisco, the Center for Integrative Medicine there. From 2010 to 2015, she served as the director of the UCSF Osher Center with its 3 core programs in integrative medicine research, education, as well as patient care. Dr. Chesney's distinguished career in integrative medicine includes her recent work as a professor of medicine and the associate director of the Center for Integrative Medicine at the University of Maryland School of Medicine. And before that, she served for 5 years as the deputy director of the National Institutes of Health's Center for Complementary and Integrative Health. Dr. Chesney is the current chairperson of the consortium of the 67 centers of integrative medicine in North America. That includes the centers at Harvard, Yale, Duke, Johns Hopkins, and particularly the centers where the work you will be hearing about this afternoon took place. I could go on for another couple of hours. This is quite the pedigree here. But please welcome Dr. Margaret Chesney.
Thank you very much, Craig. Unfortunately, with all the integrative medicine I know, every once in a while you get a virus. I have a little virus, a little cold, so forgive me, I don't usually sound quite this way, but I will do my very best. I'm so honored to be here. I want to thank all of you for coming to hear these great speakers. These are good friends of mine, and what they have to share is remarkable. They really, truly are pioneers in health. The first plenary session is focused on, does integrative medicine work? This is what a lot of people say. Does it really work? And you will hear some groundbreaking work from 3 pioneers of integrative medicine. I'd like to invite them up now. Dr. John Longhurst, Dr. Andrew or Andy Newberg, and Dr. Dan Monti to come up and sit for the panel. And you will hear, I'll give their intros later as they each come up to speak, but you're going to hear of their research on hypertension, Parkinson's disease, and so many more, and how integrative medicine does really work. Research is very much like mining for gold, and it's interesting, we're in Colorado, where I, by the way, I did my graduate work. This is really hard work, and you never know, after years and years of trying, when you will get remarkable findings, the findings like those you're going to hear about today. Our first speaker is Dr. John Longhurst. I will introduce him first, but before you get to hear his remarkable new findings regarding hypertension, we'd like to have you meet one of the faces of health, and that will be meeting one of his patients by video. A patient, Herman, and this will be one of 2 faces of integrative medicine that you'll see this afternoon in our panel. Now first, he is a patient of Dr. Longhurst, so let me tell you about John. He's Professor Emeritus in the Department of Medicine at the University of California at Irvine. He's widely published and had a stellar career, including his position of Chief of Medicine at UC Irvine, where he held several other very top leadership positions. But it was in 1999 that he founded the Center for Integrative Medicine at the university with the support of the Samueli Foundation, and it opened its doors soon thereafter. Dr. Longhurst's research interest has been on the peripheral and autonomic control of the cardiovascular system, and for the past 2 decades, he has studied the autonomic regulation of electric acupuncture. And today he will be speaking about this research, the autonomic regulation of the cardiovascular system, particularly cardiovascular function, focusing on blood pressure. And he'll speak in just a couple minutes about this. But first, we'd like to have you meet Herman, one of Dr. Longhurst's patients.
I was a federal agent for about 8 years, and I was with Los Angeles Police Department for about 38 years. So I've been doing law enforcement for a very long time. And I had no idea I had high blood pressure until one day at work, I was sitting at my desk, I was a watch commander, and I felt some pain in my shoulder. The ambulance came, I walked outside and walked out to the ambulance, and they checked my blood pressure, and it was really, really elevated, extremely so. When I found out I had high blood pressure, it really turned my apple cart upside down. And I knew I had to take the medication. I understood the medication would help me, but it was no permanent answer. I would probably have to be in the medication for the rest of my life. I wanted something different. I didn't want to continue living that way. I curtailed a lot of my activities because of it. My family is very big in alternative medicine. My daughter, she's a medical professional, but she understands Eastern medicine and Western medicine, and she's trying to give me the best of both worlds. And my daughter got some information about the acupuncture protocol, and so that's what I looked at that program. I expected and I hoped that this would have a very positive effect in reducing my blood pressure. I wanted to be off the medication. After receiving the treatments on a long-term basis, my blood pressure really started to normalize. With acupuncture, 0 side effects, needles out, you're back to doing what you wanted to do, and it still works. It's working internally, and I have such peace with it because I can really do the things that I feel that I can do. I started the program, and I'm off the medication, and the acupuncture truly changed my life. I wanted to have and maintain good health because of my job, but I want to continue that into retirement because I wanted to have a long, loving relationship and life with my wife and my kids. And I'm a very positive man when it comes to acupuncture. I know what it does. I've seen what it does. My family has used acupuncture, and it's a blessing beyond words. I just wish it could be used in more areas, and Western medicine would be more open to the benefits, long-term benefits and short-term, of what acupuncture can do for the well-being of us.
Well, Margaret, ladies and gentlemen, thank you very, very much for having me here today. I want to give special thanks to the Coors Foundation for giving me the opportunity to present our research. So, let's see if this is working now. Yeah, fine. Okay, well, I'm a cardiologist, but I'm kind of a cardiologist, but I'm a neuroscientist in that I like to get at the mechanisms of how things work. So for many years, we've been funded by the National Institute of Health to really study mechanistically how acupuncture might help the cardiovascular system in a variety of different conditions, such as high blood pressure or when people are having heart attacks, we call that myocardial ischemia. So today we're going to be talking to you really about how acupuncture might help your blood pressure. Let me see if I can figure this out. Okay. This first slide here really is to put things into perspective. That is about hypertension. Hypertension is a very, very serious cardiovascular risk. It's a silent risk because for many people, they just don't know that they have the high blood pressure until they go get a checkup maybe by their doctor, and that person tells them that their blood pressure is elevated. On this slide, you can see that, in fact, hypertension is a major cause of death for cardiovascular disease. But it's not just hypertension alone that causes a risk for cardiovascular disease, because it also figures into coronary heart disease. It's a major risk factor. It can lead to strokes. It can lead to congestive heart failure. It can lead to diseases of the arteries. So hypertension really is a major cause, underlying cause, a silent cause of many forms of cardiovascular disease. And I need to tell you that, and of course I'm saying this as a cardiologist, cardiovascular disease is the #1 killer in the United States, but it's also the #1 killer worldwide now. Even in countries such as China, for example, hypertension and cardiovascular disease have become the #1 killer, much greater than, say, cancer, pulmonary disease, many other forms of disease. So it's something that we really need to pay attention to. And in fact, as we grow older, unfortunately, our blood pressures elevate. And as shown on this slide here, you can see that for both males and females, as we gradually get older, the percent of the population who have high blood pressure gradually increases, so that by the time you're 75 or so, between 66 and 78% of the population, men and women, will have hypertension. And then that can unfortunately lead to the problems that I just alluded to. Now, much of this hypertension as we age is what we call systolic hypertension. And you'll hear me talk about systolic and diastolic pressures as I go through this talk. Systolic pressure are the high pressures, the upper pressure, and diastolic pressure are our lower pressures that we have. So we'll talk a little bit more about that as we go through the talk. So how do we treat hypertension? Well, in fact, the first thing we as physicians do is usually what we call lifestyle modification, and I'll describe that in just a second. The second thing we'll do is we will give a drug. And if one drug doesn't work, we'll give a second drug. And if that doesn't work, we may give a third drug. So drug therapy seems to be the predominant way that we treat hypertension after we try lifestyle modification. But the question that we wanted to ask in our studies was, are there other forms of treatment that might be beneficial? So if we talk then about a little bit about the lifestyle modification, in fact, you can see the various different forms of modification, lifestyle modification that can be potentially helpful. And they include things like weight reduction, altering your eating habits so that you're on a high fruit, vegetable, low dairy type of diet, reducing your sodium intake, increasing your physical activity, and moderating your consumption of alcohol. All these things will tend to lower blood pressure, and as you can see here, they'll lower blood pressure anywhere from I would say from 2 to 20 millimeters of mercury. And every millimeter of mercury that you can lower your blood pressure, in fact, helps you to live longer and to avoid all those forms of heart disease that I just talked about. So why acupuncture? Well, first of all, drug therapy is not a panacea. There are a certain number of people that don't respond very well to drugs. We also know that there are a lot of people that have side effects from taking drugs. They have these side effects, and that makes them not want to take the drugs. They have a difficulty with the frequent dosing that drugs often require, taking a dose not just once a day, but sometimes twice or even 3 times a day, depending upon the drug we're talking about. Some people simply don't want to take drugs, and I think that's probably understandable. And therefore, they want to try, like Herman just told you about in the video, some other form of therapy, maybe acupuncture. So they want to somehow invoke their natural healing mechanisms. And that's essentially what acupuncture is doing. And I'll talk to you a little bit more about that in just a second. The final thing is there's a cost associated with taking all those drugs and seeing the doctor very, very frequently for the hypertension. So patients would like to reduce the cost that is required to treat their hypertension adequately. Well, I mentioned that we've been funded by the National Institute of Health to look at the mechanisms of how acupuncture can lower blood pressure. And this is just one slide from one of our studies published a number of years ago that looks at essentially the fact that we could repetitively elevate blood pressure in this experimental model. This is an animal model. And then when we applied electroacupuncture, you can see that we could, and we applied it right here for about 30 minutes, we could lower the blood pressure very effectively. We lowered it by about 30 or 40% compared to the control here and compared to the time control over time. So acupuncture had quite a significant effect in these animal models, and we learned a lot about how it was working. What's interesting about this, and I'm going to come back to it in just a second, is that if you look at acupuncture, it takes a little while for blood pressure to go down, but even after you stop acupuncture, blood pressure stays down for a while. I want you to keep that thought in mind as we go through some of the next slide. Well, as part of these experimental studies, we decided to look at what acupuncture points might be most effective. And acupuncture points, I'm going to show you a little diagram in just a second of what I'm talking about, but these are the points along the meridians, which are along the surface of the body, that are stimulated when the needle is placed and when you stimulate those needles. And as you can see here, some acupuncture points, and I'll just call this P5, P6, that's the pericardial 5 and 6, lower blood pressure, in this case by about 40%, and the duration was long. There were other acupuncture points, and I'll just point to one here, which also lowered blood pressure, perhaps not as long. And then other acupuncture points did nothing at all. So we call this point specificity, in that some acupuncture points seem to be very effective, while others are less effective or ineffective. So we're able to then demonstrate that, in fact, like P5, P6, S36, 37, which I just showed you, were very strong. And other acupoints like LI6, 7, G37, 39 were less strong and, in fact, caused very little effect on blood pressure. And when we designed our study, we used these basic experimental findings that we had to help guide the best way to apply the acupuncture, because we know some sites would be very effective and less sites would be less effective. So we could use this as an active intervention and as a control to compare it against. Now, we went to the literature and we looked carefully at the literature at what had been done before. And very quickly, it turned out that there had been about 4 or 5 studies that had been done. But when you looked at them all together, they did what is called a meta-analysis. They found that there was no significant improvement in either systolic blood pressure or the diastolic pressure, the upper or the lower blood pressure. But a subgroup analysis showed that patients who are on antihypertensive therapy did show a decrease in these blood pressures. So we kind of scratched our head and wondered why that was true. Why only patients on medical therapy? And in fact, we decided to look at this a little bit more carefully. So we designed a study, therefore, and this shows you, it shows you the characteristics of the patients who had blood pressures that were either elevated systolic or diastolic or both, measured over a 24-hour period. We used ambulatory monitoring where we had a blood pressure cuff blow up every 30 minutes during the daytime and every hour at night. So we had a lot of blood pressures we could measure. These are patients who were off all antihypertensive therapy for at least 1 week. So we decided to relook at this question of are drugs necessary? And this gave us kind of a cleaner study, I guess you might say, to be able to look at the effect of acupuncture and hypertension. They had no attendant cardiovascular disease. They had not had a MI, a myocardial infarction, that's a heart attack, a CVA, a stroke, or arrhythmias. They had a normal electrocardiogram, and they were all cleared by their primary care physician. So let me go back one. So we then randomized them to either a control or an active intervention group, which we called EA, that's electroacupuncture. The EA group were treated with acupuncture at that P5 and P6 and S36, 37 acupuncture point. And we compared that against the control acupuncture points that we knew from our experimental studies didn't do too much. They received low-frequency, low-intensity acupuncture only once a week for 30 minutes, weekly over an 8-week period. And during this time, every other week, we would record their 24-hour blood pressure using this ambulatory monitoring during the day and during the night. So we had a lot of measures of what was going on with these patients. And here you can just see that we, in fact, enrolled 98, 65 were cleared for final study, and 33 patients ended up in the active intervention group, and 32 patients were in the control group. So here's actually the data. This is what we found. And this is looking at changes in the systolic blood pressure and changes in the diastolic blood pressure in the control group compared to the active intervention group. And you can see what happened was with systolic blood pressure, it gradually was reduced over the period of 8 weeks and was significantly different than the control group, statistically significant at the end of 8 weeks. And the same thing was found with diastolic blood pressure. The active intervention group had a lower blood pressure than the control group. So that tells you the acupuncture works. But we decided to look at this a little bit more carefully, and we actually looked at what we call high versus low responders. The high responders were the patients whose blood pressure was reduced by more than 5 millimeters of mercury, at least 5 or more. And you can see that, in fact, in the active intervention group, which is this group here, that 70% of the patients fell into the high responders and 30% fell into the low responders. And what that tells you is that about 70% of you in this audience might, if you have hypertension, respond to acupuncture, and 30% of you might not. And I would say that just the opposite was found with the control group. Now, we looked at this then a little bit more carefully, actually, over this 8-week, every other week. And you can see here that, in fact, if you looked at average systolic blood pressure, we saw a decrease in the responsive group by an average of 9 millimeters of mercury. But because we were using this ambulatory monitoring, we were also able to look at peaks throughout the day. In other words, when people were spiking their blood pressure, maybe they were stressed or something else was elevating their blood pressure. And we showed that, in fact, their peaks were reduced by 17 millimeters of mercury. So their peaks were actually diminished more even than the average systolic blood pressure. And you can see here the diastolic blood pressure didn't decrease quite as much, but it was significantly different compared to the control group and compared to when we started here. Heart rate was not changed during this study. Now, in some of the patients, we were able to actually follow them after the acupuncture. And so here we can see, for example, looking at systolic blood pressure, that the blood pressure was reduced over the 8-week period of time, and even 1 month later, blood pressure was still down. So what we say is that it took about 4 weeks or so for blood pressure to be substantially reduced, significantly compared to control. So it has a slow onset, but it also has a prolonged action. And you can see it can last for up to 1 month after you terminate the acupuncture. And by 2 months, it had come back closer to controls. So acupuncture has a slow onset, but a long, long duration of action. Now, the question that people always ask us is, well, okay, that's fine for 8 weeks, but we know that hypertension is a disease that you will have for your lifetime. It's a disease that doesn't go away. So you potentially have to repeat the acupuncture. Now, we don't have a lot of data on this, and I would say this is very much pilot data, but we did publish this in our study, which was published in Medical Acupuncture, and showed that then if we came back after the initial 8 weeks of treatment, and you can see here the decreases in blood pressure that were in this very small subgroup, and then we reapplied acupuncture once a month, because remember the acupuncture caused blood pressure to stay down for about a month after it was stopped. So if we reapplied it once a month, you can see the blood pressure stayed down. And at the end of 6 months with this once-a-month therapy, after the initial intensive 8 weeks of therapy, the blood pressure was still down about as much as it was after the initial 8 weeks. So we find this very heartening and suggests, I think we need to do more work on this, but suggests that if you reapply acupuncture only once a month, it can keep your blood pressure down, assuming that you're a responsive patient. So this is kind of the sum of our study, and I have very little time up here today, so I don't have time to go into much more detail. I'd certainly be happy to answer any questions afterwards. But to summarize, what I'd like to say is that hypertension is clearly a very serious health hazard in the United States and worldwide. Systolic hypertension is a major predictor of risk, and as you get older, you develop more and more systolic hypertension. It's often silent, and because of that, it can lead to strokes, it can lead to heart failure, it can lead to coronary disease and heart attacks. Hypertension is something we really need to pay attention to. It looks like acupuncture reduces the blood pressure response in our experimental models as well as in our clinical study, and we find that very heartening. So applying acupuncture then only once a week for an 8-week period of time, I think can definitely lower the blood pressure in many of you if you have hypertension, and I think that that's a wonderful outcome. So let me just say thank you. I appreciate the opportunity to speak before you, and at the end of this session, to answer any questions. Thank you.
Thank you very much, Dr. Longhurst. And as he said, we'll do the questions at the end, but please note your questions on your iPhones, and I'm getting those up here on this iPad, and I will be scrolling through those, and we'll handle those after the third speaker. Our next speaker is Dr. Andrew Newberg, who is the Director of Research at the Myrna Brind Center of Integrative Medicine at Thomas Jefferson University Hospital in Philadelphia. He is a professor of emergency medicine and radiology at the university, and he's actively pursued a number of neuroimaging research projects that have included the study of aging, dementia, epilepsy, and other disorders. He's also used neuroimaging of the brain, and that is where they do brain scans, which he will be sharing with you today, to better understand the impact of integrative medicine therapies, including acupuncture, meditation, and other forms of mind-body medicine. And these are all key approaches of integrative medicine. He's widely published and will present some of his findings today. These are part of the gold that he has mined in his work. Much of this work he has done with Dr. Monti, who will speak next. And he's done this at the center in Philadelphia, and they also have a center in Villanova. So now I'd like to invite Dr. Newberg up to speak about integrative neuroscience.
Well, thank you again. It's a pleasure to be here and be able to share the work that we've been doing over the past 5 years and hopefully many years going forward that I've been fortunate to be able to work with Dr. Monti at the Jefferson Myrna Brind Center of Integrative Medicine. As you heard in my introduction, part of what has been such an important part of my life and my career has been the use of brain imaging as a way of trying to understand the mechanisms of different interventions, of different diseases. And to me, it's very important in the context of integrative medicine, because if integrative medicine is going to be something that really inundates all of current medicine, medical practice, I think we really need to show the mechanisms by which the different interventions that we use work. And that's really what Dr. Monti and I have been working on over the last 5 years. And I want to share with you some of the research that we've been doing so that you can get a little taste of what we feel that we can do and how we can use neuroimaging as a way to show those mechanisms when we find changes going on in the brain as people receive some kind of benefit from the interventions that we do. So let me see if we got this going here. Oh, and before I go into the results of some of the studies and the data that we have, one of the things that we are really excited about, something that has just started for us in this past year, is we have a new site that's a little bit adjacent or a little bit off where we normally are in the center city of Philadelphia, but in the city of Villanova, which is in the suburbs of Philadelphia. And in addition to having a large clinical center there, we are having the opportunity to develop research using what's called a PET-MR scanner. So PET is positron emission tomography. MR is the MRI, the magnetic resonance imaging that we can use. And there's about 25 of these scanners in the country, so we're extraordinarily fortunate and extraordinarily excited to be able to utilize this kind of technology to develop the research that we've been doing even further, because now we can bring together these two incredible technologies into one and look at all kinds of structural and functional changes that go on in the brain in relation to the integrative therapies that we do. And this is just an example of how that would actually work, the opportunity for us to be able to look at both structure and function simultaneously in people. And this is an example of a couple of scans that we have of an MRI, which you can see over on the left, so you can see what's there. In the center, you can see the PET scan, which is looking at the metabolic activity, so it's showing you what is there is what it's doing. And then you can fuse those images together so you can be very precise about where you are in the brain, what the brain function is doing, where it's doing it, and how it works. And again, we can use this in the context of the diseases that we study, but also the therapeutic interventions, and that's what I really wanted to share with you today. So one of the first studies that we got working on was something called our NET study, NET, which stands for the Neuro-Emotional Technique. And this is a technique that Dr. Monti's been very involved from its outset. And what we realize is this is a wonderful mind-body technique. It combines a number of elements that include things like acupressure, elements of biofeedback, a kind of cognitive behavioral restructuring type of process. And the idea is that this is a very, very good tool for helping people deal with stress and anxiety. So we were hoping that while we've seen its effectiveness in terms of the clinical effects on people, whether there would actually be changes in the brain function that we could correlate with that. So we decided to evaluate this NET program on brain function, and we also wanted to see not only what was going on in the brain, but how it affected people clinically, and perhaps how it might even affect people genetically, and we hope to be able to have that data in the not too distant future. So we have actually completed this trial at this point, and we're in the kind of pre-publication phase, but we've recruited about 25 individuals. We had about 12 people in the active group receiving the neuroemotional technique, about 13 people in the control group. Basically, we decided that we wanted to take a specific population who had to deal with a lot of stress. And we decided to look at the cancer population because so many times people with cancer have a lot of distressing recollections, a lot of stressful issues related to the cancer. It could have been the original hearing of the diagnosis. It could have been the therapies that they were going through, things that caused them a lot of discomfort, pain, and just the fear of what cancer means. So we decided to look at these patients, people who had had a diagnosis of cancer and who told us that they had very substantial fears, anxieties related to the cancer diagnosis. We screened all the patients. We made sure that they were included in our protocol in terms of meeting the inclusion criteria. We also obtained blood samples from them so that we can do a genomic analysis to see if there were any changes in that. And then we had, as I said, a control group. Some people went through the neuroemotional technique, and some people we put into a waitlist group so we could see what was going on in terms of the effectiveness of this particular treatment. And we scanned them before and after the intervention or before and after the waitlist group. And we were trying to see where some of these changes would actually occur. So as people came back to us and they said, boy, you know, this technique was really fabulous. It improved my stress. I no longer, you know, we would ask them on a scale from 1 to 10 how distressing these recollections were. And uniformly, they were 8s, 9s, and 10s out of 10. After they came back, and I'm more of the imaging guy, so I was really stunned when they would come in, and suddenly they were at 1s and 2s out of 10. And one of the things that we would do in the scanner, which I always sort of thought was maybe the most cruelest part of this study, was we would actually play for them back a script of their distressing recollection. And we would sometimes bring people to tears originally in the scanner, but after the neuroemotional technique program, which is only about 3 to 5 sessions long, they suddenly didn't have that kind of a response, and we decided we should look at what's going on in their brain and see where these changes were occurring. So if you look at these scans of the brain, so here's the MRI scan, and what you're seeing here is the change in a particular area. In this case, this is where the amygdala is. And the amygdala, many of you may have heard of it. It shows up, in a lot of different studies out there. The amygdala is very involved in our fear and stress response. So whenever we are dealing with something distressing in our lives, our amygdala lights up and tells us that we have to worry about it. And this is exactly what we saw. This little red dot here is right in the area of the amygdala. And this is what we were seeing in these people when we were exposing them to the distressing recollection in the scanner. This is before they underwent the neuroemotional technique program. And if you just kind of focus right on that little area, you'll see what happened when they came back about a month later after the program when we gave them this same stressor. The activity in this area completely went away. It didn't react anymore. It was reacting to their distressing recollection in the same way as it reacts to just everyday life. And for us, that was a very important finding, that we could see why they were actually having an improvement in their distress, because their brain physiologically was changing in terms of how it was responding to that stressor. We thought, well, that's very exciting to see, but are there other things that we could understand about what's going on and how this is actually playing out in the brain itself? So something that we also can do with MRI is something called diffusion tensor imaging, or DTI. And what this does is it actually looks at the tracks themselves, the neural connections in the brain between different parts of the brain. And when we look at the brain originally, which is up here, and then this is after the neuroemotional technique, the colors represent the size of the connection. And it turns out that there was an increase in the fiber density between the frontal lobes up here. This is a kind of a side view of the brain. So here's the front part of the brain here. Here's your frontal lobe, and here's where your amygdala is. Now, this is fascinating to us because the frontal lobes are able to regulate our emotional responses, so that we use our frontal lobe if we're driving down the highway and somebody cuts us off. It's that amygdala that lights up and gets us very upset and makes us angry, and we want to yell and punch the person. And it's our frontal lobe that says, don't worry about it, let's relax, let's just go about our day. And to a large extent, that's what we're seeing right here, is that the frontal lobes of these individuals, as a result of the therapy, actually changed in the way in which they were connected to the amygdala, so that we could see the change in the functionality that we saw in the scans before. So we are in the process. This was some of our early work when we were just trying to get the study going, and we are in the process of analyzing all of the data now from our study. So hopefully we'll have some very interesting follow-up data that will help us to demonstrate these kinds of significant changes in the brain. Now, actually, the first study that Dr. Monti and I did together, and this is actually what ultimately kind of brought me over to, whoops, that was an automatic one, I think. Hopefully that'll pause there. One of the things that was, seems to want to keep going. Oh, that's interesting. Let's see. Okay. Here we go. It's got a mind of its own, so to speak. So we did a study where we were looking at the mindfulness type of program. So many of you are familiar with mindfulness-based stress reduction programs. Nationally, these have become very, very popular. They're in almost every hospital setting. I'll come back to that in a sec. Many outpatient type of settings. And what this does is it's a program that helps us to, I know I'm not touching this. What this actually does is it helps us to regulate our emotional responses. And again, this study actually looked at people who had women with breast cancer to see if we could use this kind of mindfulness-based program to help reduce their stress and anxiety in dealing with the cancer itself. And in a similar kind of setup, as I was just talking about with the neuroemotional technique study, what we did was we looked at people who had breast cancer, who had a lot of distress and stress in their lives in relation to the cancer, and we put them through a mindfulness-based art therapy program. So this was actually something that Dr. Monti had developed that takes the best of the mindfulness-based interventions and combines that with art therapy, which also can be very effective. The idea is kind of bringing together two very effective programs to see what it can do to help reduce people's stress. And what we found was some very exciting changes going on in the brain itself, where, again, we studied them initially, we studied them after they came back. Let me see if I can get back to this one slide. First of all, there was a very significant reduction in their overall anxiety scores in the mindfulness-based program. And there was also a significant correlation between the changes that were going on in their anxiety scores with changes that were going on in the brain itself, and particularly in another area of the brain called the caudate. And this, to me, as a brain imaging person, is very exciting because we're starting to see the specifics of how each of these different kinds of interventions have an impact. And that, to me, is very exciting because it means that they don't all work exactly the same way, but they work in different ways to have an impact on the brain, which ultimately has a clinical effect on the person. So, for example, when we actually look at the scans themselves, so again, here we see the brain imaging studies. This was also done with MRI. And here we were looking at what was going on during the meditation state, and we can see changes going on. These little red dots here reflect changes going on in the level, in the structure called the caudate nucleus, which also is very involved in our emotional responses and is particularly related to our reward system. There's a lot of dopamine that goes on in the caudate nucleus, and dopamine is that kind of feel-good neurotransmitter. So the fact that there are changes going on at the level of the caudate during this practice is very interesting and very important. It tells us something about how this practice works. It's also interesting that another little structure here called the insula has also been activated during the mindfulness program. What the insula does, it's kind of a link between the cortex, the outer part of our brain, and the limbic system, the emotional centers of our brain, and it helps us to regulate and to actually feel the emotions themselves. And the idea that this area of the brain has actually changed as the result of this meditation practice becomes, again, very relevant in understanding the mechanism by which this actually happens. And when we ultimately look at the changes between the post and the pre, again, we can see changes going on at the level of the caudate, the insula, and parts of the frontal lobe that reflect the clinical changes that we're seeing in the patients themselves. And to me, again, this is very important for helping to ultimately convince the larger medical community, because it's one thing to kind of parade up the patients and say, here's where we see the changes, improvements in anxiety, and they have an improvement of 20% or 30%. But when you can show somebody a change in the brain itself, they know that something physiologically is happening. Actually, this is just a blow-up of that particular slide showing the changes going on in this caudate and in this insular area of the brain. These reflect the actual correlations of changes and the actual changes themselves between the meditation program, pre and post, and you can see how much there's improvement in a number of these areas of the brain. So the caudate nucleus, the insula, and these are just some graphs that we were able to generate from that imaging data. And that to me is also always important, that we can quantify them. It's not just me showing you a picture, but to be able to actually show you the numbers themselves and to see where these changes are occurring. Basically, in all these different areas, we see substantial increases of activity in areas regulating our emotions. Here's that amygdala again showing up, where we're able to regulate the emotional responses of the person more effectively. The last study that I want to spend a few minutes on is our Parkinson study. This is an ongoing study, and we're very excited about this. Oh boy. This comes back to another approach in integrative medicine, which is the use of different therapeutic botanicals and other types of molecules, antioxidants and so forth that may have a benefit that we can see in the patient itself. So what we've done with our Parkinson study, wow, this is really, I don't know if somebody back there is doing this or one of the things that we are able to see with Parkinson's in terms of how it works physiologically, Parkinson's is a deterioration of the dopamine neurons in the brain. And what we think is going on at that level is that there's a lot of oxidative damage. Now, exactly why that gets kicked off in the first place, we don't know. But what's going on in people who have Parkinson's is this slow progressive deterioration of the dopamine system, and that's what ultimately manifests in the symptoms. So the most common symptoms, because dopamine not only is involved in your emotions, a lot of people with Parkinson's wind up with depression, but also regulates our motor activity, and that's why people wind up with rigidity and with tremor and the inability to move very effectively. So when we were looking at the pathophysiology of the disease, we realized, well, if oxidative damage is an important part of this, maybe we can use something that could help relieve some of that oxidative damage. Glutathione is the body's natural antioxidant, and one of the best ways of replacing that glutathione is by using a compound N-acetylcysteine, which is basically falls within the rubric of the antioxidants, which your brain and your body ultimately uses to regenerate the glutathione in your body. So what we did was we took people with Parkinson's disease, usually in the early to moderate stage, and we gave them a course of N-acetylcysteine that we gave them both as a combination of an intravenous infusion 1 day a week, as well as to take it orally. It comes in capsules that you can take, and we had them take those capsules on the other days when they weren't actually getting the IV infusion. Let me just see if there's anything else I have on this slide. And what we did was we decided to scan people before and after receiving the N-acetylcysteine with a type of scan called DAT scan. I don't know why I'm really fighting with this today. Oop. So this is one of the DAT scan images that we have on one of our early subjects, where what you can see, the scan on the left was their pre-treatment scan. The darker the red areas are more active, more dopamine activity in the brain itself. This is what they look like when they come in initially. This is what Parkinson's typically looks like. They have very little dopamine in their brain. And this is one of our best responders, but you can see a substantial amount of dopamine binding after he had the treatment with the N-acetylcysteine. And when we look at people as a group, and we compared all of them, we could see, again, very significant increases of activity, of dopamine activity in the caudate nucleus. When we actually look at the statistics, whoops, again, we can see that there were very substantial increases in the N-acetylcysteine group, going up from 2.5 to 2.7, 2.7 to 2.8 in a number of these very central dopamine areas of the brain. So again, to us, this is very exciting. We have the ability to see physiological changes associated with these integrative techniques, and we hope to be able to carry this work into the future with our PET-MR technology and to be able to look at a lot of the different integrative approaches, acupuncture, and other types of novel therapeutics that we can use to help the patients that we take care of. So sorry about the slides, but thank you very much, and moving on.
Thank you so much, Andy. And maybe if the technicians could look quickly through Dr. Monti's slide to see if that would be okay, that'd be great. I know that I'm getting some really good questions like, what is hypertension? And some people may have wondered, the NAC was the N-acetylcysteine. And so we'll capture some of those questions in the question and answer period. So put those on your devices, and I'll pull those all together. If we don't get to all of the questions, what I could do is try to see if there's a way we could publish something and send it out to people that have attended the meeting, the questions we don't get to. So I don't want to take any more time. I want to introduce Dr. Dan Monti, who's the Senior Vice President and the Ellen and Ron Kaplan Director and Professor of Integrative Medicine at Thomas Jefferson University. And he oversees the Myrna Brand Centers of Integrative Medicine, both at Thomas Jefferson and now their satellite at Villanova. He has extensive experience in integrative medicine, particularly on the role of natural molecules and lifestyle in health outcomes. He's widely published, and under his leadership at Integrative Medicine at Jefferson has more than tripled its operations, which is just really remarkable in the city of Philadelphia. The center's research division is very active, providing with new evidence that you'll hear about. You've already heard some from Dr. Newberg. You'll now hear more from Dr. Monti as he speaks about micronutrient research program. So, but before you get to see that, you get to see another person who's the face of integrative medicine, and that is Diane, who's benefited by her participation after diagnosis with cancer in the micronutrient program. So we'll run a quick video and then hear from Dr. Monti.
I had some symptoms that suggested something was wrong. So I went to my doctor and I suspected that I had a urinary tract infection. And so was given a course of antibiotics. And when that didn't treat it, we realized that it was something else. So went in for further testing and had an ultrasound done. And that's when I received a diagnosis of bladder cancer. When you receive a cancer diagnosis, it's pretty overwhelming. There's a lot of fear and anxiety that comes along with that. You go through, everyone knows the natural stages of the shock and the fear, and you immediately dive into the worst. So then you dial it back and you say, okay, we've got to put a plan together to get treated. I was spending too much of my time and energy on fear, and that couldn't help me. So I wanted to find a way to kind of divert my energy from fear to healing. I was a year into my diagnosis before I even was aware of the options that were available in integrative medicine. I want to control my health care, and I want to do everything possible to fight and to stay cancer-free. I was getting the very best medical care that I could, and I was healing, I was recovering, I was getting in front of it, and I wanted to do more to stay in front of it and to do everything in my power to keep the cancer away. And I knew that there had to be something more. That's where integrative medicine came into play. And I believe that integrative medicine can give a patient a tool to help harness the body's healing power to support your medical treatment. When I first learned about the options that were available at the Integrative Center, I was surprised to learn that nothing was covered by insurance. So a lot of it had to come out of pocket. So it was a little concerning. The expenses were high. I made the decision that I was going to dedicate myself to getting cured, and I would do whatever it took. And fortunately, I was in a position to do that. And I recognize not everybody is. And I believe people should be given a choice to seek out whatever medical coverage they need. Patients and their doctors should be allowed to make decisions regarding their own care rather than insurance companies and government bureaucracies. So I'm now 2 years into my cancer diagnosis. I've been cancer-free for 10 months, and I have a very positive outlook. The tools that I've gotten through the Integrative Medicine Center, it's improved my life. I live with hope. I don't have the fear. I really wanted to find a way to take all of that energy that was going towards fear and convert that towards healing and hope. And I've done that with the tools that I've gotten here. I can honestly say that the tools that I've learned and the treatment that I get has made my life better. It has given me hope. It really has made a difference. I don't fear anymore. Every day's positive, and I'm in front of this. I am cancer-free, and I believe I'm going to stay that way.
Hello, good afternoon, everybody. It's really a pleasure to be here in Denver, Colorado, one of my favorite places in the planet. So for those of you who are lucky enough to be local, good for you. And this is really an amazing opportunity to get together with all of you and with colleagues to talk about some of the exciting things that are happening in integrative medicine. Many thanks to the Coors Foundation for making this happen. That is just one terrific group of people, from the people who answer the phone, to the executive director, the people who staff it, to the benefactors behind it. Really a wonderful group that does a lot for our field. And it's really an honor to be sharing a platform with people like Dr. Chesney, who's a giant in the field of integrative medicine, Dr. Longhurst, who, as you see, has done amazing work, and Dr. Newberg, whose imaging work and research is transforming our understanding of integrative medicine. I want to talk a little bit about micronutrient research and nutrient therapies with a focus on two: vitamin C and N-acetylcysteine. Dr. Newberg mentioned N-acetylcysteine for our Parkinson study. Interesting, two different bodies of literature led us to that molecule for two very different types of diseases. The patient in the video received two interventions from us. One, the vitamin C therapy, which I'm going to start with, and also the neuroemotional technique that Dr. Newberg mentioned in his imaging study. I think that was the tool she was talking about, and then the treatment she was talking about was you kept seeing somebody creating an IV fluid bag, and that was our nurse making the IV vitamin C infusion. And so our approach to integrative medicine is preventive health, modern technology. That's the PET-MR and all of the genomics profiling and everything that we can do, and innovative therapies, which we like to explore them and test them and push the boundaries of medicine as we know them. And so the focus of today's talk from Jefferson is really the innovative therapies. And it was planned that we would actually start with Dr. Newberg, who has those wonderful images to show you, and that really dynamically engages the group, and then the patient who makes it all real, because we needed to raise the excitement level, because some of my slides can be a little bit boring. So as we get into the science a little bit, remember that patient who makes it real, and I'll try to do the same. So I want to start with vitamin C, and a lot of people have heard about ascorbic acid, or vitamin C, and cancer, because it has had such a colorful past with a lot of debate and controversy. And this is largely due to the high level of attention vitamin C, and it peaked probably in the 1980s, early 1980s. And Linus Pauling, who many of you know, two-time Nobel laureate, very smart guy, led the charge for exploring vitamin C as a possible therapeutic option for patients with cancer. And what he did is work with a Scottish physician, Dr. Cameron, and they treated some patients. And they didn't really pay attention to how they gave the vitamin C, because back then, and this is in the 70s when they did some of their initial work, the pharmacokinetics of vitamin C had not been worked out. Nobody knew that there was anything different about vitamin C if you gave it orally or intravenously. And what we've learned since then is that some substances and some drugs are very different, whether you take them orally or intravenously. For convenience, in the Pauling-Cameron experiments, they would oftentimes give it intravenously because these were hospitalized patients and it was just easy to do so, not because there was an intention to do so. And when they designed then, and Pauling was involved with this design, the Mayo Clinic studies to really look at this, to really look at the observations of Pauling, for convenience, they made it oral, and because they focused on an outpatient population. And really nobody thought that there was much of a difference. And so Linus Pauling was very puzzled when there was no change from 10 grams of oral vitamin C, which is a good hefty dose of vitamin C. And in fact, it's probably the point at which most people start to begin to have some side effects from it, because it can be a little harsh on the gut at a high level. And they did a study. He said, oh, there must have been flaws, design errors, let's do this again. They did another study and didn't seem to have much of a therapeutic benefit to take this large dose of oral vitamin C. The issue was pretty much put to rest. Pauling still felt there was something to it. He remembers the results that he saw in these patients when he was doing the Cameron experiments. But everybody just kind of moved on from vitamin C at that point. And Pauling could never figure out why he saw something, but then the Mayo Clinic studies didn't really show something. Nobody ever thought anything of this difference between oral vitamin C and intravenous vitamin C. Until my good friend and colleague, Mark Levine, who's at the NIH, he's the section chief of molecular nutrition in the division of NIDDK there. And in the 90s, he was charged with reestablishing dietary requirements of some of the vitamins. And so vitamin C was one of the things he was assigned and decided to work on. And he realized that nobody had done pharmacokinetics experiments on vitamin C. And so he wanted to understand blood levels and how long you achieve a certain blood level after ingesting it. And that gives an idea of what your dietary requirements are for the day. And so he did these experiments. And so he looked at oral vitamin C and intravenous vitamin C, and he realized, oh my gosh. And as these curves sort of show, oh my gosh, there's a huge difference in what happens with blood levels of the same dose when you take it orally versus intravenously. This had not been worked out before. And the reason for that is there's very tight control of vitamin C. There's certain things our body tightly controls so that blood levels don't get too high. And there's reasons for that. And we don't actually, as humans, manufacture our own vitamin C. Some other mammals do. And our bodies tightly control it. You're not going to actually absorb more after a certain amount, and that's, you're going to get some, it's going to come out of you relatively quickly, because when you take it orally, it's tightly controlled and you can't get a high blood level. Now this led Dr. Levine at the NIH to think to himself, I wonder if that had anything to do with the differences observed by Pauling versus the Mayo Clinic trials. So he went back and looked at everybody's original writings, original research, and saw that Pauling and Cameron gave it intravenously a lot of the times. And that made him think, gee, I wonder what's going on with that. I wonder if it's a different substance pharmacologically, since you get these high blood levels. And that led him and his team to do a series of experiments where they saw when it becomes drug-like, when you infuse the vitamin C, it actually causes cell death when you do cell line studies to many different cancers, but not healthy cells. And then they tested that same theory out again in animal studies, again showing that you would get cell death, I mean, not a complete eradication of a tumor, but that it did something. It had a biological activity that destroyed parts of tumors while leaving healthy cells intact. And so the mechanism by which that occurs, and so, you know, if you're not a biochemist, don't worry, I'll make this really simple. So basically, it's in biochemistry a simple redox reaction, we call it, but the ascorbic acid, which is the vitamin C, so that's the technical name for vitamin C, ascorbic acid, what it does is go through a series of reactions that leaves you with that H2O2. You see that H2O2? That's hydrogen peroxide. Hydrogen peroxide, that's where we believe a lot of the biological activity is. Now, to kind of orient yourselves, so right here we're in a blood vessel, and here we're in what we call the extracellular fluid. So that's the fluid that surrounds the tissues, including tumor tissue. Only when you infuse the vitamin C at a high dose do you get a high enough blood level, because remember, it's tightly controlled if you just take it orally. Do you get a high enough blood level for some of this vitamin C to go into the extracellular fluid? When it goes into the extracellular fluid, it makes the vitamin C, and what you don't, it makes the hydrogen peroxide, and then what you don't have is a bunch of this stuff breaking the hydrogen peroxide down. This allows the hydrogen peroxide to go into the tumor cells. It also can go into the healthy cells, but healthy cells have intact mitochondria and other aspects of the cell that don't really mind the hydrogen peroxide that much. But cancer cells, especially many of the rapidly dividing types of cancer cells, don't like the hydrogen peroxide, and that is what leads to the cell death. That and some other things. We actually are about to publish another study to show that there's also that the vitamin C itself goes into the cancer cells, and the combination of the vitamin C in there, depolarizing calcium channels, things like that, along with the hydrogen peroxide, that's adding more information to the mechanism. And again, we're still working the mechanism out, but this is where it's been for a while. The next step was, okay, we know that the vitamin C, or the ascorbic acid, an ascorbate, it has all these names. Ascorbate, ascorbic acid, vitamin C, all the same thing. That we know that it isn't going to be a standalone therapy. For us and for people in the scientific community, the issue is, since there's virtually no toxicity, and that's been worked out in other studies, and we've done some of that work, and there's the potential for it to actually improve the cancer, can we add it to certain types of chemotherapies so there's a synergistic effect? Not just an additive effect, but a synergistic effect where it's more than 1 + 1. It's equaling 2, it's 1 + 1 equaling 3 or 4 or 5. And so some of the work that Dr. Levine did in his laboratory in both cell line models and in animal models, in vivo models, was to show that certain chemotherapeutic drugs combined with the ascorbic acid, the vitamin C, gave you a special level of impact on the tumor. And so gemcitabine, which is used to be kind of the gold standard treatment for pancreatic cancer, seemed to, in animal models, have this synergistic effect. So what we decided to do at Jefferson, and Dr. Newberg and I worked closely on this study, was to do a phase 1 study of vitamin C, ascorbic acid, plus standard chemotherapy for pancreatic cancer, which included gemcitabine. It was a combination of, at the time, just a couple of years ago, gemcitabine plus erlotinib. Now, the gold standard for pancreatic cancer, the chemo part, has changed, which has led us to go back to another phase 1 versus the phase 2 of this one, but I'll talk about that in a second. So what we did was a dose escalation trial, because nobody really established what dose do you go up to, and not that this work was definitive, but was a step in that. What dose do you go up to? What's reasonable? So based upon all of the anecdotal evidence that was out there, and converting what we knew from animal models to human models, we decided to do a dose escalation of 50 grams IV, 75 grams IV, and 100 grams IV. And the drug is still pretty well tolerated at 100 grams, but that is about when you start to see some side effects. And we have a paper in press kind of showing that's when you're starting to get some side effects. So to go higher, you may decide to, but you might get more side effects. And the side effects are fleeting, they're minimal, they're things like temporary nausea or headache or some lightheadedness. There was really very little to no adverse events from the ascorbic acid. I mean, it's the chemotherapeutic drugs that cause the problem. But interestingly, some other studies have shown that when you use the ascorbic acid or the vitamin C, it can actually dampen some of the side effects that you see in other chemotherapies. And that was, oh my gosh, and that was done on ovarian models. And so basically what this study showed is that, unusual to just the chemotherapy itself, there was some regression in almost every one of the patients. Again, not complete eradication, but some regression. And we published this in a journal called PLOS ONE, and they actually asked us to make this so that the readers saw the primary tumor went down. And so this was really exciting to us, and we're doing other tumor types, and one of the other ones that we're looking at right now is hepatocellular carcinoma, and that's what's allowing us to better understand the mechanism like we did. But we also, in the little bit of a clinical population that we've had, we're reporting in another study that's about to come out, our kind of case study. And the treatment for hepatocellular carcinoma is a drug called sorafenib, which doesn't, tend to shrink tumor much, and it hasn't been reported in the literature to shrink a bony metastasis. But this is a rib lesion on one of our hepatocellular carcinoma patients, and what you can see is that after one course of the vitamin C, it didn't change very much on the MRI, but after the second cycle, it almost disappeared. And Dr. Newberg remembers the exciting day when he looked at that imaging, and this is sort of kind of blown up, after first cycle, not much, but then look at that after the second cycle. Almost unheard of with metastatic hepatocellular carcinoma. And these are CAT scans that, again, show that same sort of progression of that rib lesion going away. Now, it's a case, and it's a case connected to some translational work, but it's all very exciting. The other study that we've been doing with the Coors Foundation is to look at another molecule, the N-acetylcysteine, and I'll wrap it up in just a minute. I'm sorry to run over a little bit here. And that is to look at the microenvironment of cancer cells. And so it isn't just the cancer cells, but also the environment they're in. We call it the stroma. And so fibroblasts are part of that, and they're part of what can fuel the cancer. And there are these different markers that help us to understand that and to see that. And so one of them is caveolin 1. And when we get to questions, if people have more specific questions, I don't have time to kind of explain what these two things are, and the other is MCT4. But basically, our study, we know that oxidative stress creates an unfavorable profile in those fibroblasts that can fuel the cancer cells. And so we did an intervention with the N-acetylcysteine with breast cancer patients, stage 0-1. It was a brief intervention, but high potency, powerful, to see if we could reverse some of those marker changes that you see in the microenvironment of the tumor. And sure enough, we were able to kind of push it in the direction that we wanted to, where we decreased the expression of MCT4 and increased caveolin-1. And so I know that it's kind of 15 minutes is a short amount of time to talk about things like the biology of micronutrients, but that we have question and answers, and thanks for your attention.
This is really hard. There are so very many good questions. So I will talk to the organizers about how to try to get some of these answered in a way that we could send the information back to you. But I thought I would start with questions for Dr. Longhurst, and you can take them right there. Maybe just say just briefly what hypertension is, and maybe incorporate in that why it seems to increase in age, particularly for women, just as a quick start.
Sure. Hypertension is essentially high blood pressure. So our blood pressure is really the pressure that we measure inside our arteries. The doctor, when you go to see him or her, will put a cuff around your arm and will listen to the sounds and will be able to measure the systolic, which is the upper part of the blood pressure, and then the diastolic, which is the lower part of the blood pressure. So hypertension is an elevation of that blood pressure. Now, over time, our vessels get stiff. We lose some substances in our vessels called collagen and elastin. They become more like rigid pipes. Our blood vessels become more rigid. So for every beat of the heart then, there's a greater elevation, particularly in the upper blood pressure, the systolic blood pressure. So that happens with both men and women. It's a natural function of aging. It's something that is very difficult to prevent from happening, although things like exercise, for example, and eating a healthy diet can help to keep the blood pressure lower. Still, as you could see on the slide that I presented, many people, as they age, their blood pressures do elevate.
There was a question about, just real quick, make these brief, plant-based diets and what effect that might have on preventing hypertension. Right.
Well, plant-based diets, for example, a Mediterranean diet is a good example, really helps to keep a low amount of cholesterol and fats in our blood vessels, and really helps to maintain their compliance, so they're less stiff, I guess, over time. So that helps to keep a lower blood pressure, helps to keep a lower body weight overall, and they can be very useful.
Great. Another question was, does the acupuncture have to be electric acupuncture, or would traditional Chinese medicine with needling work?
Right. So the question is electroacupuncture versus what we call manual acupuncture, which is where we just place needles in and then perhaps manipulate them a little bit, but there is no electricity stimulation of the needles. Well, we chose electroacupuncture mainly because it was very simple to use. That is, we could put a needle in, we could hook up this little battery-driven device to the acupuncture needles and flip a switch, and it would stimulate them at exactly the frequency that we wanted to use and exactly the current that we wanted to use. So it allowed us to very definitely standardize the acupuncture type of program that we were using between patients and between acupuncturists, for that matter. So it was mainly a matter of just standardization. In the community, you will find that manual acupuncture is probably used more frequently than electroacupuncture. The difficulty with manual acupuncture is that it's harder to standardize, and so it's harder for a practitioner to use exactly the same type of stimulus from one time to another. So that's the reason why we believe that electroacupuncture is very, very beneficial.
There was a question about whether or not the acupuncture was bilateral.
Yes. So, and I should have mentioned that. Yes, the acupuncture was performed bilaterally. So we used two acupuncture points here, P5 and P6, bilaterally, and then down on the leg, we use 2 more acupuncture points on both sides. Now, the reason, by the way, why we use 2 together is because there is a needle in both, and the current flows in one needle and out the other needle. So it's then very localized in terms of the stimulation. These are 2 acupuncture points, P5, P6, S36, 37 are both located very closely together, so there's very local stimulation. It's not stimulation that's going, say, across the body. It's only in the one set of acupuncture points on each side.
He's doing really good as I pepper him with questions. Here's one, whether or not this acupuncture would be beneficial for someone who had recent onset hypertension, like
Yeah.
early stages.
I don't think it would make much difference whether it was recent onset or had the onset had been some time ago. I think acupuncture potentially could be beneficial for both. But the caveat is that we used it for patients with mild to moderate hypertension. That is, their blood pressure systolic was not above 170, so it was, and normal blood pressure for adults is, say, up to about 130. So the systolic blood pressure was between 130 to 170. We tried a few patients that had elevated blood pressures higher than that, and in fact, they were not as responsive. So that's the reason why we stayed with the patients with mild to moderate hypertension. But I think whether it's recent onset or onset some time ago would not make much of a difference.
Another question was whether or not you believe that acupuncture of this nature would be beneficial for arrhythmias.
So the question is about arrhythmias. So, of course, our laboratory is interested in many different areas. We have not specifically studied arrhythmias, but there have been some studies around the world. In fact, there have been some very nice studies on an arrhythmia called atrial fibrillation, which is a very, very common arrhythmia that occurs in the upper chambers of the heart. And there, acupuncture has been shown to be beneficial. This is from an Italian group.
One final question was whether or not acupuncture of this type of treatment could be self-administered with patient education.
Yeah. So the question is whether it could be self-administered. Well, I would like to say yes, but unfortunately at this point we don't have the ability to put in needles and leave them there for long periods of time. With auricular acupuncture, which is, by the way, we've just received another NIH grant to study auricular, that's ear acupuncture. There are some needles that are left in place for a period of time, but out in the periphery, what we call somatic or body acupuncture, we don't leave needles in for long periods of time. Now, to be quite frank with you, we were very interested in developing a what we call a smart electrode system that would be stimulating the acupuncture points transcutaneously. And what I mean by that is you put the electrode on the outside of the skin and it would stimulate through the skin to essentially stimulate the underlying neural pathways. Now, a big point I did not make, and I'd be happy to discuss this offline, so to speak, because it's a long discussion, is that the way acupuncture works is by stimulating the sensory nerve pathways. That's what our basic science experiments have shown. So whether it's an external electrode or a needle inside, you basically have to stimulate those neural pathways. These are sensory nerves that give information up to the spinal cord and eventually to the brain. And that's how acupuncture works. So the answer is, we hope in the future that patients will be able to use it themselves. Right now, we don't have studies that show that, in fact, they can administer acupuncture to themselves. So at the present time, you're kind of limited, and at least you have to be shown by an acupuncturist where to stimulate and go back. And hopefully it would only be once a month or so to repeat that stimulation after an initial 8 weeks of intensive therapy.
Thank you, John. I know we started a little late. I'm hoping we can ease a tiny bit into the break period so I can get a few more questions. There was also a question about how much does acupuncture cost and whether insurance covers it. I can answer that acupuncture, it ranges from about $35 to a visit to $100 or more per visit, and so you can check. Their credentialed people are licensed, and MDs administer acupuncture, but also people that are licensed, and that is an LAC license. And And increasingly, it's getting covered by some insurances, and you should check. In the state of California, state of Illinois, and state of Maryland, it's now covered as part of the Accountable Care Act, or the Affordable Care Act. So there's increasing coverage for it, so it's something that I would expect would increase in the future. I'm going to go now, we have to sort of switch gears. There were a lot of questions about dementia and aging and Alzheimer's that I really want to ask our experts. And maybe, Dr. Newberg, you could take these to start. Are there integrative approaches for dementia or Alzheimer's, including some of the agitation and aggressive behavior that comes out later? Are there supplements, dietary approaches, and issues around anything involving the microbiome? Maybe if you could speak just briefly about that, but there are some other questions relate to neurodegeneration as well.
It's an excellent question, and obviously has a much longer answer than we'll have time for. But I mean, as a general statement, what the data seems to show is that the more people can follow a kind of integrative approach, the better off they ultimately will do with a variety of different neurodegenerative diseases. So the more people can work towards a more healthful diet, such as the Mediterranean or plant-based types of diet, and get rid of a lot of the red meats and other processed foods that are so inundating our shelves these days, that can be very helpful. Exercise is excellent for many of the neurodegenerative diseases. A variety of different supplements have been tried. There have been different kind of pros and cons, and some have been able to show some benefit, others have not. There actually, interestingly, are some studies that have looked at a variety of different antioxidants, including N-acetylcysteine, as being potentially helpful for people with cognitive impairment and dementia, particularly Alzheimer's disease. Does anything reverse these neurodegenerative diseases? No. But they can potentially be helpful. And even practices like meditation, mindfulness, and so forth, if the person is not so far through the process of dementia where they can't do it, obviously, that would not work. But we've actually even just recently published an article in the elderly and in people who have some mild cognitive impairment, and these meditation-based programs can actually work very well to help reduce anxiety, stress, and help to improve behavior and even memory to some degree. But again, these are not, at this point, there is no cure for any of these neurodegenerative diseases, but all of these different integrative approaches can help, and if they can each help a little bit, then it can be beneficial to people.
Can you say anything about neurodegeneration diseases and whether or not turmeric, olive oil, flax, or is that covered by what you've already stated?
Yeah, that's more or less covered. There have been some studies that have looked at a variety, turmeric, again, as an antioxidant, having the beneficial oils, the omega-3s and so forth. There's been some benefit to them as well. So, working towards that kind of a healthful diet and including some of those supplements can be beneficial. Those are some of the things that we work on. And actually, blood pressure and making, a lot of the cardiovascular risk factors also go into play with that too, and trying to optimize them as well.
My colleagues and I have been doing some research to see what we could do to slow cognitive decline in people who have moderate or beginning cognitive impairment. And we have found in our pilot studies that exercise that includes some mindfulness, some yoga stretching, and things of that nature, and done in a social framework with others present where they're looking at each other as opposed to classroom style where you're all looking just at me. It would be where people are put in a circle, and that this actually improved cognitive function in people with moderate dementia. And one thing about integrative therapies is the idea here is to integrate, to combine diet and some of these approaches. There was a question actually, Dr. Longhurst, for you, but it relates, I think, also to some of the things that Dr. Monti was saying, and that these therapies are often combined. So the question for you, Dr. Longhurst, was would you combine acupuncture with medication at the start? And I don't want to shortchange Dr. Monti, so maybe I want to just pick up on this, and sure. Then could you tailor out the medication, for example?
Yeah.
Taper it out.
Yeah, I think the answer is yes. As I mentioned, the 4 studies that have been done previously suggest that acupuncture can be beneficial in patients who are on medical therapy. So I think the combination of the two is potentially good. Obviously, I think the goal of many patients is to try to get off the medical therapy as much as possible. So if they can wean themselves off the medical therapy after they start the acupuncture, I think that would be good. Again, we used in our study patients who were not on any medical therapy because we did not want any confounding effects of the medical therapy. We wanted to look at pure acupuncture to ask the question whether acupuncture by itself, without the confounding influence of maybe taking a pill one day and not taking a pill the next day, could still lower the blood pressure. And the answer was yes. But I think that, yes, together, acupuncture can be useful. And I will say other lifestyle therapies, such as weight loss, reducing your sodium intake, improving your diet, exercise, all these things come into play, and they should all be used. We don't use these therapies in isolation. We use them together.
Thank you so much. Dr. Monti, are there nutritional ways to fight breast cancer that has metastasized to the bone?
It's a great question. A lot of the things that we're talking about today, whether it's for cancer or neurodegenerative disorders or even cardiovascular disease, we're targeting a couple of mechanisms because we know about them and we know that these interventions actually can be helpful. One is inflammation and one is oxidative stress. And inflammation and oxidative stress fuel virtually every disease process we get concerned about as we enter adulthood and then the middle decades of life. The things that increase inflammation and oxidative stress, some of them are within our control, some of them are not. Some of the things that we can control range from everything that we're talking about, from our activity level to what we're putting in our bodies to our stress levels. All of those things have an impact on inflammatory chemicals. We know, for example, that stress chemicals that then lead to inflammation can make cancer tumors in the laboratory grow quicker than without those things. We know that cardiovascular disease, that Dr. Longhurst has such great expertise in, even when I was in medical school, it was taught in a very mechanical kind of way. There's a nick and then the plaque forms, it isn't that doesn't occur, but there's a whole inflammatory process in the endothelium of the vessels that is now much better understood. And so there are so inflammation and oxidative stress are what we're targeting when we talk about things like omega-3 fatty acids. They lower inflammation. Turmeric that somebody asked about, that lowers inflammation. The N-acetylcysteine may lower inflammation, but it's a big targeter of oxidative stress, and that's why it's important for the cancer study I was talking about, but its ability to be an antioxidant and to lower inflammation might be why it's so helpful with the Parkinson's disease study that Dr. Newberg spoke about. We know that these things are great for prevention, that there is correlation to prevention if we, for modifiable risk factors for things like cancer, cardiovascular disease, neurodegenerative diseases. All of the correlational data that's out there would suggest that we would be wise to eat the kind of diet that Dr. Longhurst and Dr. Newberg mentioned, a plant-based, more of a Mediterranean diet with healthy fats, and lots of green vegetables and all of the other good things that we know about, increasing activity level. When you're in the disease process, it depends upon where you are in the spectrum of the disease process to know how helpful. I mean, sometimes things are very, very far along, and so it's difficult to intervene at that point with some of these things we're talking about, and there to be a big measurable difference. Certainly for mild to moderate disease in neurocognitive disorders or even cancer processes, you can make a difference in quality of life, health outcomes, how people respond to treatment, certainly with cardiovascular disease as well. When cancer is so far along, you probably need a little bit more than dietary interventions, but I would certainly marry those healthy lifestyles with whatever other novel therapies, because the combination makes sense.
Thank you so much. I know that there's some questions we didn't get to, but we're going to have a break next. And I believe our speakers will be staying around. So I would encourage some of you to come up and ask your questions to them at that time. But I think what Dr. Monti just said really is empowering for all of us, that integrative medicine offers not simply something you do with a practitioner, and it can start with you. And the idea of integrative medicine is to take complementary approaches to medicine and integrate them into your lifestyle and integrate them into conventional medicine. It's not, pushing all of that aside, but really forming a personalized care plan that works well for you. And I'd almost like to quote Diane when she said she wanted to convert her fear into healing and hope. And I would say for all of us, sometimes when we think about cancer, hypertension, cardiovascular disease, and developing dementia, it's very frightening. But by living a lifestyle that's more integrative in the approaches that our great scientists here have described, we can convert our own fear into our personal healing, our hope, and better health for now and into the future. Thank you so very much.